NASNPRO spa, wonderful warriors, beauties, and rock stars. I am so excited to be here with you today, and we have specially curated content just for you. But before we get started, let's talk about last week. We were in beautiful Phoenix, Arizona. And for those that joined us at the National Aesthetic Spa Network, if you haven't been to one of our events, you're missing out. Why? It's not just another event or conference or trade show. And if you haven't gone to an event, a conference, or trade show this year at one of your local events, you should. I mean, our community needs you and we miss being together. So whether you go to a big trade show or one of a smaller event, I know I'm going to do a shout out. iConnection in San Diego is going to be this week. So go see your fellow colleagues. They miss you. And guess what? Those vendors, those sponsors can help you with your business. But getting back to Phoenix, Arizona, first of all, Phoenix in October is a great time. Not too terribly hot, and the beauty of the desert always comes out. We had Michael Tompkins, Tasha Chen, Cheryl Goodheim speaking at the event along with Dr. Jay Laconda. It was a compact circle of science, inspiration, academia, business, and all of us walked out with a wow moment. So we're going to drop in our links one of the things that Tasha gave away. Now, if you're not familiar with Tasha Chen, she is a financial guru that talks about how to manifest in money. And for those of you that know me, know I do work a lot with energy and those feels and that holistic practicing. So when you talk about money flowing to you or why it isn't, wow, this just resonated. So she gave something special to each and every member that was at our event. And we want to make certain that that gets to you. So just, watching the links below in the comments section, and we'll post that to you. But wait, we are going to Dallas, Texas, actually Frisco, Texas, which is, my understanding is about 15 minutes right outside of Dallas. Super easy to get to from Dallas, Fort Worth, or Love Field in a beautiful facility called the Frisco Hall. And I have a meeting with them today. We're going to be talking about catering and setup. But this event, again, we're bringing in science, academia, inspiration. And if you haven't registered for the Dallas event, make certain that you do. So good morning, good morning, good morning. We're so glad you're here. Drop a link in the comment section. Let me know where you're watching from. It's so good that you're here joining us because we do have two fabulous speakers today, and we love sharing information with you. And I said this at the Arizona event. Part of my passion is that I don't know everything. I wish I did, don't you? But we don't. And to constantly be getting better, we have to learn. We have to stretch ourselves. We have to keep moving forward. And if anything, the last 18 months have proven is, boy, do we need to learn? Do we need to change how we do business? And do we know how to stretch ourselves? I can't wait for 2022. I think a few other people are excited about 2022, and we have a great new lineup of places that NASNPRO is going to be coming to you, along with some more virtual education. But let's get back with Dallas, Texas. Bobby Calhoun is going to be talking about malachite. What the heck is that? And what does it have to do with our cortisol? Then Dr. Laconda. And if you have not tapped in to him as a resource, he is a phenomenal chief scientific officer His information and knowledge about cosmetics and ingredients is just superior. Then we also have Jim Harrison talking about essential oils, emotions, and manifestations. A little bit similar, maybe as to what Tasha, but in a different way, like how our emotions are holding in our body and how maybe aromatherapy can push some of those negative emotions out. I don't know. Go register for November 1st, Dallas, to hear Jim. Then a very special guest is joining us. She's actually been featured on Undercover Boss. That's Gina Rivera. She is joining us as a cosmetologist. She's the owner of Phoenix Salon Suites. It's a nationwide suites that she rents out. She's also been a cosmetologist, but her family has been in cosmetology for almost 60 years. And she sent us her books. She's going to be giving a book out to everyone that goes. So again, go register at NASNPRO.com or NASNPROtv, either one, to register for that November 1st Dallas event. It's our last one of the year. It's going to be a great party. Then we also have Stephanie Holvick speaking about how to get written up in print or how to get showcased in print, how to get marketing. How do we get into those newspapers? It is a great, informative, knowledge-based content presentation that you are not going to want to miss. But let's say you haven't been to any of our events this year. I don't know why not, but let's just say you haven't. Did you know that if you go into our NASNPRO.com, log in, and under our member portal, our educational portal, there is everyone's PowerPoint. So you can go back if you have attended and want to do a refresher, or if you haven't, you can go back and look at this. Did you also realize that there are some really great rewards? So why haven't you logged in to NASNPRO.com? Or let me ask you this, why haven't you shared about NASNPRO.com to your SD bestie? Are you keeping us a secret? I mean, I know we're friends and all. I know that we like to keep things just between you and I. But really, to make our community stronger, we need to be stronger, bigger, and help each other. And that's how we help each other. So please, if you could do me a favor and go share about NASNPRO.com with your aesthetic friends, with your aesthetic community, in some other groups, that would be great. Now, something did come to our attention. The Office Depot. I sent out an email. We also made a post about it. The Office Depot printing reward has gone up. They are saying, due to cost and et cetera, that's why it's gone up. So instead of the 2.1% or 2.1 cents, not percent, cent of printing, it's now, I think, gone up to 4 cents. It's still a great deal. We are working on getting new cards for everyone. But, in the meantime, the code, the number is all the same. So just know that that did go up. But do keep in mind that, first of all, Office Depot is a complimentary benefit that we give. We do not get any kickbacks off of that. Our membership is free because we truly want you to be able to tap into resources to help your business, to help you personally and professionally. So that is our gift to you. Now let's talk about what I'm going to be giving away, because it's all about the swag. So we were really excited to meet one of our newest members, one of our newest sponsors, and that's LaFleur. They are, and this is what I'm giving away. So at 12 o'clock, be back on So we're going to do the education right after I give these announcements. Then at 12 o'clock, I'm going to come back and we're going to do the Google Wheel of Excitement. But I wanted to share what you're going to get, what some lucky person is going to get. This is the LaFleur Longevity Essential Oil. You can really see what a beautiful color it is. It has turmeric and cardamom, and I want to say ginger, but I think I need my glasses on. Arnica, that was it. Turmeric, arnica, and hibiscus. But wanted to, I love this color, and that's why I thought there was some ginger in it, but I guess it's a turmeric. It has a really great aroma, but then you can just see how nice this goes on. It glides. You can use it as a massage medium, and that is going to be in your gift today. One lucky person is. So look at, can you see the difference? I don't know if you can or not. This is the one. See how nice and glowy this is and how dry and sad this hand is. So, and LaFleur does live probiotics. Their website, if you want to find them, you can go on lafleur.com. Reach out to them. Let them know that you're a NASNPRO member. See how they can hook you up, because I know they were giving special deals. So this one is mine. I'm not going to give you an open bottle. I have a brand new one. Then from Anna Latone, who doesn't love a little chocolate spread all over their body? So we have a beautiful little container of that. Then from Dr. Grindel, we have some body cream, and it has a beautiful silky texture, body cream with epigreen and argan oil to smooth and soften and firm the skin. So thank you, Jennifer Crable from EpiPen, and also Dr. Grindel for giving this. I'm going to share this with the members. And did you know that we gave an EpiPen machine away at the Arizona event, and we're doing it again in Dallas? Then from Sunshine Botanicals, this is a rapid repair fluid. Great results. A lot of people love using it on rosacea, anyone that has congestion. And it has, I was going to say what one of the main ingredients, it is a whole leaf aloe vera compound with calendula. It also has tinctures of benzene, so it's a beautiful skin fluid. Then, just to make certain that everything is clean and sanitized, we're going to give an Ultra Sand from DMK, but also their age management kit. So, thank you to all of our sponsors. So that's 1, 2, 3, 4, 5, 6 products that's going to be sent to you. And I usually always kind of send something else in there. So whoever wins. So how can you win? Make certain that you have registered at NASNPROtv to be able to win this swag bag today. Everything is Eastern Standard Time. So meet me back here at 12 o'clock after you've watched our specially curated content from Elaine Sterling. Now, if you don't know Elaine, Elaine Sterling is a Sedesco diplomat. She has her own school in Atlanta, and she also has formulated her own skincare line. Amazing powerhouse woman, and you're not going to want to miss her segment. Then we have Nicole Cocuzza, who is been an instructor, an esthetician, a beauty entrepreneur. She has her own now studio in Arizona where she does educational not services, but she does education. She's teaching on dermaplaning, micropigmentation. I mean, she just has a whole lineup of different classes that she teaches. She has also formulated a great line called Skin Religion. And she's going to be talking about dermaplaning and how we can level up our services and treatments in our treatment room. Elaine Sterling is going to be talking about microneedling, both, again, right after I finish. We're going to go into those segments and they're just going to play. So thank you so much for being here. I love spending time with you. I love that you are a NASNPRO member. And again, if you haven't shared about the National Aesthetic Spa Network with one of your aesthetic friends, please do. Let them know that we have such amazing opportunities to win EpiPens, Skin Classics, LED lights. I mean, we've been giving some really great products and equipment out this year. And we would love to see you at our last event in Dallas, Texas, November 1st. So next Monday, 7 days from now, make certain that you register so that you can get your lunch in. We need to know who's going to be there. So have a wonderful day. Enjoy the education. Drop a comment. Let us know where you're watching from. And I hope that you are lucky enough today to win our swag bag. But even if you don't, know that we are in the last quarter. We're going to make it a great rest of the year. We are going to move forward, push all that old energy stuff. We're going to leave it in the past and rocket ourselves into 2022. So enjoy today's content and have a beautiful day. Let's go.
To microneedling. I'm Elaine Sterling. I'm a licensed esthetician, a licensed esthetician instructor. I have my Sedesco diplomat as well as ITech diploma. Today we're going to talk about microneedling. So right off the bat, I always like to let estheticians know the first thing you need to do is check with your state licensing body. And does microneedling fall under your scope of practice? I know there are many estheticians that are performing microneedling procedures. I feel that microneedling should only be done under a doctor's license, under the right medical insurance. But again, it all depends on what state you're in. And if you're not sure, you could always contact your licensing board and the medical board and make sure that your professional liability insurance covers you for microneedling. Today, we're going to discuss the history of microneedling, the benefits of microneedling, contraindications and the importance of client consent, pre and post care defined, understanding needle depth, and treatment protocols. So microneedling may be thought of as a new aesthetic procedure, but actually it goes back thousands of years. First of all, if you think of acupuncture, that was really the first form of microneedling in the skin to really achieve vital energy or life force flow. Nowadays, acupuncture is used to improve the body's functions and promote natural self-healing process, which is actually what microneedling did. But the first recorded use of microneedling procedure was in 1905 by a German dermatologist, Ernest Kromeyer. He used various size dental burrs powered by a motor-driven flexible cord equipment to treat scars, birthmarks, hyperpigmentation. Microneedling, as we think of it today, was first used in 1995 by Dr. Desmond Fernandez for the treatment of wrinkles and scars with the use of hypodermic needles and small needle stamps to induce collagen production. So this later led to the development of our modern microneedling devices, and there are many devices that we'll go over in this lecture today. So I want to talk about needle depth. I also believe as estheticians, we are working in the epidermis. So if you have a look at where the epidermis is on the slide and where the dermis is, so your 1.5 to 2 millimeters is definitely going into the dermis. Your 0.25 to 1 millimeter is really going just to that papillary dermis. So I feel this slide really shows you how you can dial that needle depth. Remember, the skin is, of course, thinner on the forehead and around the eyes and more sensitive on the upper lip. So you're able to really target the depths of the needle and trigger, because your 1.5 to 2 millimeter depth is to reach the deep dermis where there are scars, all right? And then your 0.25 to 1 millimeter needle depth is to reach the epidermis or the papillary dermis, which is the upper epidermis, for the fine lines and pores. Now, I will tell you that even a light depth of 0.25 to 1 millimeter is triggering the dermis to build collagen and elastin. So what we call CIT, collagen induction therapy, where we microneedle the surface of the skin to break up old collagen strands and stimulate the production of elastin fibers, restoring a smoother appearance. Because if you think about, we want a plump and juicy dermis with a beautiful smooth epidermis. So we're trying to trigger collagen and elastin to reproduce. Devices. There are many types of devices. Of course, you all know about the rollers. I think that's where we all started. There also, you'll see a lot of rollers that are sold for home use, and those are going to be not penetrate the dermis at all. Those are just going to basically stimulate the skin and help the serums penetrate. You do get rollers that go into the dermis as well. You get stamps, pens, and then of course you have seen recently combined with radio frequency. And I'm sure you've all heard of vampire facials or PRP facials, protein-rich plasma facials, which really help stimulate the skin as well. So what does microneedling help? What are the benefits? So of course, fine lines and wrinkles, scarring, acne, reduce the appearance of enlarged pores, thinning hair or hair loss. It does stimulate the production of hair. Okay, so even if you're doing it on the face, it can stimulate the production of hair. But this is fabulous for people that have hair loss, where you can stimulate hair growth on the hairline and in the hair. And there are hair serums that you can purchase and you can use that are designed to combine with microneedling. So that's a whole practice on its own that you could have in your center. Skin pigmentation issues, stretch marks, loose skin, such as after weight loss or liposuction. What are the risks? I would say there aren't that many risks because it's almost almost like think of when you prick the skin, right? It tends to heal very quickly. And also think about when you're aerating a lawn. You're aerating a lawn and you're putting punctures in that grass, but there's healthy grass around the puncture. So you're injuring the skin, but there's healthy tissue around that injured skin. So the healing process is so much quicker. And I would say start with that, not that deep depth, right? See how the skin reacts. What are some of the risks? Swelling, discomfort at the site, redness, bruising, dryness, flaking of the skin. Bleeding is an uncommon reaction to microneedling, though it may be more likely to occur after a deeper treatment. Some further complications. Bleeding may also be more of a risk for people who have bleeding disorders who are taking blood thinner medications. It is important to disclose this information to a doctor before receiving this treatment. There is also a risk of more serious side effects, including infection, skin pigment changes, reaction to topical medications used during the treatment. So I would say always take a thorough intake form. Find out what they're using at home in their skincare. See if you think that they should be stopping their vitamin A, retinoids, tretinoins, their AHA, BHAs, pre and post care. Make sure that they do not have an immunocompromised system, because we are triggering the skin to heal itself. So we are really looking for an intact epidermis and a healthy person that does not have any contraindications that may inhibit their healing process. Some contraindications are skin infections, active acne, very pustular acne. We don't want to break open those pustules. We don't want to spread bacteria, nor do we want to, spread bacteria, cause scarring, hyperpigmentation, or post-inflammatory hyperpigmentation. Eczema, herpes simplex, blood clotting conditions, active bacterial and fungal conditions, immunosuppression, not recommended for women who are pregnant or nursing. Micro injuries. Mechanical remodeling of the skin using a medical microneedle penetrates the correct depth. Remember, we talked about that, either into the epidermis, that's 0.5 to 1 millimeter, or down deeper into the dermis for the thicker parts of the face, or for deeper work on scars, depending on the skin condition, in order to reach the dermis and stimulate the production of collagen, elastin, and hyaluronic acid. The treatment works by causing controlled microinjuries, which stimulates a healing response in the body. Microneedling is a device with multiple tiny sterile needles that are pushed in and out of the skin, causing tiny punctures. Think of your sewing machine, in and out, but with lots of little needles, either punching or needling or rolling that skin like it's aerating the lawn. The body then repairs these tiny punctures by producing new collagen. After the treatment, patients should leave the blood on their face for at least 1 hour. Blood contains many useful growth factors and anti-aging boosters. The channels that are open following microneedling are only open temporarily, so we want the blood to absorb as effectively as possible. So the microneedling is leaving those channels open so that your serums that are designed for microneedling can penetrate into the skin. You also need a slip and glide for the microneedling on the skin. So a hyaluronic acid that's designed for microneedling, that'll help the microneedling pen move along the skin, is very useful. Make sure that you use serums that are recommended and designed and or PRP serums for microneedling specifically. Wounding and repair. Microneedling triggers the skin and immune system response. The increased blood flow assists in the creation of new tissue. Proliferation. The wound is rebuilt with granular cells and new network of blood vessels. It remodels. The wounded areas were replaced with new dermal tissue and rebuilt with granular tissue. So think about you're building collagen and elastin, you're wounding the skin, the dermis is triggered to heal that wound. Fibroblast, the principal active cell of connective tissue. Fibroblasts are large, flat, elongated, spindle-shaped cells possessing processes extended out of the ends of the cell body. The cell nucleus is flat and oval. Fibroblasts produce tropocollagen, which is the forerunner of collagen, and the ground substance and amorphous gel-like mattress that fills the spaces between the cells and the fibers in the connective tissue. Collagen remodeling. New collagen production forms after 14 to 15 days. This process continues through days 20 to 21. The new skin integrity lasts for several weeks to several months. Collagen production normally peaks after 6 months. So what is this slide telling you? This slide is telling you that collagen and elastin is being produced, collagen production, well after when you stop the microneedling, right? So we're forming at 14 to 15 days, continues through day 20 to 21, and then several weeks to several months after that. So if you're doing it in a series, every month for a lighter depth, or every 6 weeks or every 3 months, you really are building a lot of collagen. And there's very few things that we have in our toolbox, few modalities that can really build collagen like microneedling can. Collagen. Collagen refers to a family of proteins that are the primary structural component of connective tissues, such as skin and cartilage. About 90% of the collagen in the body is type 1, which is found in the skin. There are many different types of collagen, 16 to be exact. Type 1 collagen is used for strong hair, skin, nails, and bones. Type 3 is used for the same. While type 2 collagen is less prevalent within our bodies, it still offers great benefit to the aging body by promoting joint and cartilage health. Depth of penetration. So we talked a little bit about this, right? The home derma roller, remember the one that I talked about that you buy over the counter, is about a 0.2 millimeter and a 0.3 millimeter model are specifically designed not to penetrate and not to cause pain. So no topical anesthetic is needed, and it's great for the client to have that at home in between their microneedling to stimulate the skin and to help with their product penetration to use with serums, etc. In the treatment room, longer needles, 1.0 millimeters to 1.5 to 2 millimeter and 3 millimeter, can cause pain, but also produce a very good result and may need topical anesthetic to numb the area treated. Numbing makes the procedure more comfortable. Normally, to numb, this is a 4% lidocaine or other anesthetic creams applied 45 minutes before the procedure. So here's the thing about microneedling. You know, when you're doing microneedling and they're going to have the numbing on, they're going to have to come 30 minutes prior. So you can put the numbing on And then you could massage the décolleté and hands because they're waiting 30 minutes. You could also use a jade roller to kind of roll over the numbing. So there's things that you could be doing during that time, right? If you're staying under 1, you probably won't need numbing. But like I said to you, the forehead is very thin around the eyes, around the orbital area, and the upper lip tends to be sensitive. Obviously, the cheeks are a little fatter, so they tend to be not as sensitive. If you look at how you do microneedling, think of microdermabrasion, where you're creating that cross hatch, and you can also do little circles as well. So here's a guide on this reference chart that just shows you how many millimeters roughly you would be doing on certain areas of the face. For example, the forehead. Remember I said the forehead was a little thinner, so 0.25 to 0.5. On a thicker skin, you could go a little deeper. So this is just a nice guide. But honestly, once you start doing microneedling, you really don't need this chart because you kind of understand a thinner areas under 1. Thicker areas over 1. Inflammatory responses. Microneedling on active acne may result in the spread of acne and infection, can worsen rosacea, and without correct skincare can aggravate melasma. So we really need to make sure that this client is a candidate for microneedling. And I always say in aesthetics, 1 foot on the gas, 1 foot on the brake. Maybe keep it under 1 for their first one to see how the skin behaves during the treatment and how the skin behaves after the treatment. And then maybe if they're on a series, you can increase that as you see the tissue response. And there will be erythema on the skin. The skin will be tight. And I always tell the client, your skin's going to feel thirsty. Side effects experienced with the skin needling are very minimal and usually subside within 24 hours. They do include redness, stinging, itching, tightness, and perhaps even slight peeling. Results. Visible results of skin rejuvenation are seen after just 6 to 8 weeks following the procedure and continue over the following months up to a year. A course of 3 skin needling sessions at 6 to 8 weeks intervals is usually recommended to achieve optimal results. However, great skin improvement is notable just after the first treatment. Clients are also encouraged to use a derma roller or a derma stamp in between their skin needling sessions to enhance procedures and the results. Now, remember what I said was the home use needles do not penetrate the skin. So make sure your clients are not doing this on their skin at home. They are not estheticians and they are not licensed professionals. Pre and post care. Avoid sun exposure 24 hours prior to treatment. Discontinue the use of retinols 12 hours prior to treatment. You should not have any active breakout, active cold sores, or open lesions. If this occurs, your microneedling treatment should be rescheduled. Wait 6 months following Accutane use. We don't do any facials, any waxing, any facial services within that 6 months of stopping. It's going to be after that 6 months because the skin is very thin and very sensitive. Wait at least 48 hours before or after Botox treatment to have a microneedling treatment. Because you've had injections in your face, there is injection sites, okay? So we don't want to go over those injection sites. 1 week before or after any fillers, such as Juvederm, Restylane, or 1 month before or after laser treatments. We need an intact epidermis, a healthy skin, and a healthy client. Only use the mild products for the next 24 hours, like a gentle cleanser, a gentle moisturizer, a hyaluronic acid, definitely a chem-free SPF. Day 2 through 4 post-procedure, use a gentle cleanser and a chem-free sunblock, as well as continue using daily supportive skincare. Avoid exercise for 3 days following the procedure, and no sun exposure for 3 days. So we really want to make sure that we don't do this on the week of a special event, and that they're not going away, and that they're not going to be in the sun. Combining services. Of course, I talked a little bit about the vampire facials, the PRP facials, but you could also do microneedling and chemical peels. You could also do LED, sheet masks, combined with cooling ice globes, all right? But it's very important to do a skin analysis, client consultation, and consent forms. Now, the chemical peels and the microdermabrasion, I recommend you alternate your chemical peels and your microneedling. However, whatever device you choose, you will go with the manufacturer's guidelines. Whatever chemical peels you're using, of course, you can check with that lab, that manufacturer, can you combine these with the chemical peels? Likewise, with any serums you're using for your slip and glide over the skin or using afterwards, make sure that that serum can be used in combination with microneedling. Liability and insurance. I said to you in the beginning, really check with your state board regulations. Is this under your scope of practice? Does the state board allow it? Do you have the correct licensure to perform this procedure? Do you have liability insurance that covers you for microneedling? Do you have a medical director? Are you falling under his license, or are you working in a medical office with a medical director present? And are you covered under his liability insurance and under his licensure? These are all questions you should ask before you start microneedling procedures. Again, every state is different. Why do I love NASNPRO? I think what I love about NASNPRO is how we connect with estheticians and spa professionals from all over the country in a very intimate setting. When you go to spa shows and trade shows, which I love because it's fun, the education is there, it's fast paced, there's lots of booze, but this is very targeted, focused education so that we're able to connect with the therapists in their state, spa owners, spa directors, and we're able to support the therapist with education and networking on a very individualized basis, which makes us a stronger community. I really believe we're stronger through education. I believe that the medical fraternity in our community takes us seriously through licensure and education and professionalism. I believe in spa excellence with a combination of professional ethics and skills. Learning skills today that you can put into practice tomorrow is what advanced education is all about. NASNPRO has been able to bridge that gap, giving our esthetician community a place to learn and thrive together. And isn't that what we need during these times? I'm Elaine Sterling. I'm, as I told you before, an esthetician instructor. I own Elaine Sterling Skincare, and I own the Elaine Sterling Institute in Atlanta, Georgia. We have an esthetician program, a nail care program, cosmetology, and massage therapy. We have over 400 students in a beautiful space inside Lenox Square Mall in Buckhead, Atlanta, where it is a college-like campus. It was always my vision to have a college-like campus that raised up the therapist, the licensed professional, and gave them a place where they could really learn their foundation and hone their craft and be taken seriously and take skills that they learn today and put in the treatment room tomorrow. So I really want to thank you by listening to this little class today, this mini class on microneedling. Even if you don't do microneedling, I hope it's given you some insight and some questions to ask your client or some of the microneedling manufacturers of which way is the best way for you to go to help grow your business. So let's talk about an instant door prize. So, product information. The first person to respond in Facebook thread wins. So here we go. I am going to ask you a question. In 1995, who was a South African plastic surgeon that really created the small needle stamp to induce collagen therapy? Who was that trailblazer, that South African trailblazer that really put microneedling on the map? And the first one to respond in the Facebook thread wins our brand new face and décolleté lift that has probiotics, peptides, hyaluronic acid, and vitamin A. This was so fun. I look forward to seeing you, and I can't wait to send you your incredible prize. And I cannot wait to support NASNPRO in the future. And if you're ever in Atlanta, I'd love for you to stop by the school and come see me. It's always wonderful to chat and hang out with other licensed professionals and students and help support you in your vision for your future. Bye. Thank you.
Hello, fellow beauty ambassadors. My name is Nicole Cocuzza, and I am the founder of Skin Religion, naturally sourced active skincare for professionals. We are here today to level up your dermaplane game. So we're going to take the actual popular dermaplane treatment that we normally do work with in our rooms to another level to reach the best capacity of your client's skin concerns. Also get the best result-driven ingredients and products to use and get the best result with whatever your client's skin concerns are. Okay, so we're going to be talking about a multifaceted version of your client's skin, their skincare, their concerns, and we're going to kind of talk about how we can level up each one. But today, I have my beautiful model Mona here, and her concerns are hyperpigmentation, of course, signs of aging, slagging skin, some fine lines around the forehead area. So we're going to address that with the most simple, effective, and result-driven ingredients, okay? Mixed with our dermaplane treatment. So this is how we're going to start, okay? First thing we're going to do is we're going to cleanse the skin with a really nice, gentle cleanser. So we have to remember when we're dermaplaning, it is manual exfoliation. So our hands and the weight of our hands are going to determine the level of exfoliation we're going to get. So we have to be very mindful of that when we're working with sensitive skin types or skin types that tend to be temperamental. So we want to make sure the ingredients are always nourishing and have nutritional value. So we're going to use Skin Religion's Cleanse. This is a multi-fruit, very gentle cleansing milk. I'm going to put a little bit in my hands. I'm going to start right at the chin. And we're just going to give her a nice gentle cleanse. So when I say it has multi-fruits in it, this is natural organic sugar cane, sugar maple, a little bit of white willow bark, aloe leaf juice, okay? So all these nourishing ingredients that are going to actively get into the skin to deep clean, but also not leave any irritation behind, not leave any dryness behind. And we all know that organic sugarcane is a derivative of glycolic acid. So you're actually putting on a little bit of that glycolic acid, which is, as we know, that number one sourced ingredient that actively desquamates the surface of the skin, actually more effectively than any other acid. So we're actually cleansing and loosening up some of that dead skin, okay? So we're gonna give her, like I said, this nice gentle cleanse. And with dermaplaning too, you don't have to run into too many steps. We're just taking it like little by little, because we're mixing a pretty aggressive modality and we have active ingredients. So we don't have to be piling up too many ingredients. You can choose to do steam if you like to soften the skin a little, or even just for a more relaxing experience, go right ahead. Just don't keep the steam too close to the skin or on for too long. And you're gonna also wanna leave the steam on at the beginning of the facial only, during the stimulate, agitate portion of the facial, because that's what we're doing. We're stimulating, agitating, okay? So stimulation, cleanse, light exfoliation, we're gonna dermaplane, and then we're gonna repair and respond, okay? So that's how this whole facial is going to go. Now, depending on your client's concerns, you have to be mindful of skin type, of course, condition. Ask a lot of questions, because a client may come in and their skin may look perfect. Wow, great candidate for a dermaplane. But we need to ask questions like this. Is your skin temperamental? Do you get active flare-ups that kind of come out of nowhere, like maybe a rosacea condition that you don't know or they don't even know they have? So you have to be extremely mindful when doing a dermaplaning treatment, especially after the first treatment, or excuse me, before the first treatment, because you don't know their skin that well, okay? So we're making relationships right now. I'm making a relationship with Mona's skin because I've never treated her before, okay? So we're gonna be mindful with our pressure and our ingredients, okay? So she's cleansed. What I'm gonna do next is interesting. I am going to take some of my tonic, because we all know the best thing to do before dermaplane is to degrease the skin, okay? That's what we learn in school. Degrease, get a deeper exfoliation. That's smart, yet when we talk about degrease, we think about products with maybe alcohol in them or acetone, and that can actually compromise the barrier of the skin and make the client more sensitive to the active ingredients or performers that you're going to be using. So I choose to use Optimist. It's my grapefruit tonic. It's just got natural grapefruit juice in it. It's got no added alcohol, so it's more like a freshener than anything else. So look for those words when you're buying degreasers: freshener, tonic. They're much lower in alcohol content, and usually fresheners don't have any. But it's going to give her that nice cooling feeling, great experience, and also just give the skin that little bit of degreasing that she needs. So back to Mona's concerns. She's concerned with hyperpigmentation, fine lines, of course aging. This is all a very common concern. But I'm really going to hone in on that hyperpigmentation. You can kind of see here, she's got it solar right around her eye area, okay? Usually a result of environmental damage, sun damage. Could be also melasma, which we should know how to identify melasma. It's a lot harder because it's hormonal. It's a lot harder to lighten and brighten. So we want to kind of have a catch on that. So we have determined that it is more sun related. And we're going to kind of go in those areas with more performing ingredients to help lighten and brighten. So we're going to kind of mix and match the treatment, okay? Now, we all know also licensed professionals are to be doing dermaplaning treatments, okay? There's a lot of people out there that are not working in their scope of practice. They are not certified in these areas, and we need to understand that when clients are going out and coming to you, you have to have your license posted, all your certifications, its credibility, and people want to see this, okay? The people that don't want to see it, you don't necessarily want to be treating, because normally a lot of times you do an oopsie or something happens, then the person comes back and says, I didn't see anything on the walls, I don't even know if she was licensed or he was licensed. You have to have all of your credentials out for the client to see at all times, okay? Because there's a lot of imposters out there. Okay, so I choose to use a number 3 handle. It's a stainless steel dermaplane handle. okay? This is not disposable, okay? You can sterilize it and reuse it, okay? And then it's compatible with a number 14 blade. And I choose 14 because I like the rounded at the tip. So when you're working around the delicate areas like the nose or the eyes, you have this little area that if you're to swipe or to have a little, accident, you're not going to slice the client's skin, okay? So we're gonna take our blade. Always wait to put the blades on when your clients are with you. If you open it up and you put it on the table, oh, my client's coming in, I'll have it all ready, and the client cancels or doesn't show up, now you have a contaminated, unsterile blade. So open it up, snap it on, take your little piece of wrapper and just chuck it, okay? So we have a nice firm grip there. This is a stainless steel tip, okay? And you can also use carbon steel, all right? There's two different types. Stainless steel seems to fit better. I think you get a deeper exfoliation, less chance for irritation and less chance for infection, okay? So stainless steel, it costs a little bit more, but it's actually, I think it's better, but it's your choice, okay? So we're gonna start on Mona's face right in here. This is the glabella area. I always like to start here, and then I choose to go left, come back up, choose to go right. And the reason why I do this, it's like giving a haircut. It's called precision treating. So when you're precision treating, you're actually not liable or able to miss a spot or go over one spot too many times, because that could also cause irritation. So we're gonna start right here at the glabella. We're gonna take the blade at about a 45-degree angle. And we're gonna I like to just start kind of going chicka, 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 chicka. I use a lot of sound effects, that's just the way I work, okay? And just get your mojo going. You don't have to just go in and start, jamming away. Get your mojo, get the feel of the pressure you wanna use right here at the tip of the nose. Come up a little bit, being mindful of the eyebrow area. And just work gently right up to your forehead area. Now notice how I'm working within the perimeters of my fingers. This way I'm protecting her. I'm covering her eyebrows so we don't have any oopsies in the eyebrow area. And I'm covering her hairline because I don't want to give her a haircut. This is a facial treatment, not a haircut. Okay, so I came straight up. So now I have, as you can see, mostly dead skin and vellus hair, right? You see that here. So what I'm gonna do is I'm gonna take my cotton round, I'm gonna dip it in a little bit of water, and I'm just gonna place it right here, and I'm gonna do a little wipe. Now, it's important to wipe frequently because you can dull the blade. You can also nick the client if there's little particles on the blade. So make sure you are wiping frequently. As you can see, I am kind of working my way to the left. And I'm not working too fast, I'm not working too slow. Also, with more clients that are concerned with aging, they tend to be a little bit drier. And this treatment naturally can dry the skin, especially if you're using active performers to lighten and brighten. So we're gonna do something really interesting after I do this one pass, which I'm working kind of swiftly but mindfully, okay? I'm gonna stretch right as I get around to here, like the half moon around the eye area. I'm gonna stretch the skin and I'm gonna come straight towards my heart with the blade. It's another thing with dermaplaning, always think come towards your heart. So always make sure you turn the client's head or contort them where you need it for their safety and yours. And normally I will say, and I said to Mona earlier, I'm gonna be contorting your face for your safety as I get into different areas. It's important that you not talk, cough, or sneeze. Gloves are always best practice. As you can see, I kind of have my special way of doing this. There really is no wrong way as long as you're comfortable and you're getting in there and getting the right exfoliation and you're double bracing and always practicing client safety. I'm going to juice that labial fold again. I think I may have missed it on this side. I'm going to go up towards the chin. You can even see the skin start to glow. And her skin is just loving every minute of this. You doing okay, Mona? Okay. I'm going to finally finish off on the nose. And we are good. Normally after Dermaplane, I don't go and wipe off what I've already put on. I just want to kind of gently, blot the area. I'm just going to kind of tone it a little bit with some more of that Grapefruit Optimist tonic. I'm going to take these lovely little heart-shaped sponges because every client should be touched with love. And I'm just going to wipe this away. Her skin should not feel dry. It should not feel tight. It should not feel irritated. Now for a really, really fun part is we are going to do an enzyme. Enzymes work great with dermaplaning. Again, depending on the level of depth that you've worked with, the ingredients you've already used. If they're too aggressive, usually I don't like using an enzyme. So we didn't use a lot of crazy actives. We used more nourishing ingredients, okay? Ingredients that have nutritional value. So we're going to use Goddess Seed. This is a cooling mask. It has natural organic eggplant extract in it, which is actually more potent than vitamin C, guys. So it's going to help to lighten and brighten. I'm going to take our little mask brush. Now it is an enzyme, so your client after this treatment is going to feel a little tingly. So you let them know that you may feel a little tingle, may feel even a little bite. Just means your skin is alive and kicking, and you're going to be all good. Focusing on that eye area where she has a little bit of hyperpigmentation. This should feel cooling. It should not feel aggressive. She should not feel uncomfortable. How are you feeling, Mona?
Okay.
Okay. She just said, it's okay. That wasn't very positive. But I'll take it as a good thing because she's not crying or anything. Okay. This is just a very, very gentle gel mask. Again, very cooling. I even leave some of my enzymes in the fridge or the freezer for just a few minutes to get them nice and cool, especially in the summer months, because it just gives that instant cooling feeling. So we're going to put this on. And since it is a gel, it's not going to dry right away. So we want to, again, make this experience really nice for Mona. So I have my lovely Cool Globes sitting on ice over here. These I never leave home without. My Cool Globes are my life. Waxing, facials, dermaplaning, microneedling, whatever. I always finish with my Cool Globes. And I like to give just a little comforting and cooling facial massage with that enzyme. Doesn't have to be a long time, but it feels nice on the skin. It just takes it down to a calming level, stimulates, even kind of constricts the pores slightly so they get that nice tightening, toning feeling. These are also great to use for facial massage, working right around that eye area. Okay, you don't have to do it too long. You could do it, I mean, we're limited for time because we're on a 30-minute segment, but there's so many different fun modalities you can mix into this treatment to really make it relaxing and very, very stimulating. And it sets you apart from everyone else. You always want to step out the protocol box, guys. You know, I always say the best, what do you call it? Dishes that you cook, best meals, they don't come from the back of a rice-a-roni box. It's always what you add to it to make it, your own. Put your own fingerprint on it. Make it special. Your own protocol. You always want to be that esthetician that, ooh, I went to this one esthetician and she did this after this. I never had that done before. It felt so nice. It's basically just taking that little bit of extra attention. That's all. And love. Always stopping at the temples, never pulling away. Okay, so she's not shocked there. I am going to refresh her again by spritzing a little bit of the Optimist. Then I'm going to take a moist towel from my towel caddy. It's a mess, so don't pan out. I'm going to wring it out a little bit here. You guys never want to use a super, super hot towel for anything. Always take your towel, open it up away from the client's face in case you get hot drips. We don't want that. We're going to air it out a little. They tend to cool off quickly. I'm going to rest it down like this, like this, and just press. Going to take the towel. We're going to remove it quickly because we are, again, limited for time. It's okay. Go for it. Okay. Going to remove the rest of the gel. I'm going to apply Skin Religion's Hyaluronic Serum. Also contains alpha lipoic acid, B5 and B3, which are, again, essential nutritional value for the skin. Result-driven ingredients, guys. 2017 game-changing finalist in the International Skin Games competition. So it's proven to work. We always know we finish with a serum and end with a what? Anyone can tell me? What do we always end with in our facial treatments? We end with SPF. Woo, woo. Gotta have the SPF. So I'm using a natural, Skin Religion's natural rosehip seed oil and hibiscus, and it also has zinc oxide, okay? And this tub is hers to take home, so that's why I'm double dipping. Just to let you know. Who else? Because I know there's a lot of aesthetics police out there. This is going to be Mona's to take home. Okay. So I am using a physical sunscreen, zinc oxide, much, much safer than chemical. I think I may have put a little too much on here. But notice how this product does not leave a white cast. It actually will go right in to her skin and leave her with a nice barrier of moisture and protection. So you guys, Nicole at skinreligion.com, reach out to me. Tell me that you were here with me today, and I'll have a special little package of a Dermaplane starter kit with these products in it for you. Again, Nicole at skinreligion.com. It will be put on my website, but I've been a little slow in modifying it. So if you reach out to me directly, I'll have it to you a lot quicker. And I'll explain to you what that is. It'll be just a little starter kit with some of these fun things. And you guys can practice, have fun, and start seeing some really, really, really awesome results with your client. I hope you guys had a great day. Reach out to me with any questions. And thanks for coming in.